Welcome to EMTprep.com. This is the Patient Assessment Management Trauma Skill.
Welcome to the Trauma Patient Assessment and Management Skills Station. Here we will evaluate your ability to assess a patient, interview them, and verbalize the treatment of all conditions you find. As you move through the skill evaluation, I want you to voice everything you are assessing. During the assessment, you will have 2 EMT partners to assist you. I may have to clarify treatments with you during the assessment as they arise. You have 10 minutes to complete this skill. I want you to review the equipment before you at this time.
Okay, I'm ready.
You've been dispatched to a 24-year-old female who was ejected during a motor vehicle accident. She is lying 30 feet from the car. Police have cleared the scene and it is safe for you to approach, and you may begin your assessment at the patient's side.
BSI, is my scene safe?
Your scene is safe.
All right, based on dispatch information, my mechanism of injury is ejection from a motor vehicle. Is this my only patient?
This is your only patient.
Okay, right away I'm going to go ahead and request ALS intercept. And then again, based on mechanism, we're going to take full C-spine precautions with this patient. General impression, I have a 24-year-old female who's been ejected from a motor vehicle. I'm going to determine level of consciousness really quickly. Miss, can you, Miss?
Ow.
All right, my patient responds to painful stimuli. We're going to go ahead and assess ABCs. I'm going to assess my patient's airway. Is there anything in her airway?
There's nothing in her airway and she's breathing.
Okay, awesome. So her airway is patent. She's breathing. What is her respiratory rate?
Her respiratory rate is 30 breaths per minute.
30 breaths per minute. All right, I'm going to auscultate lung sounds. All right, my patient responded to palpation of that side painfully.
Patient has decreased breath sounds on the left side.
Okay, decreased breath sounds on the left side. Couple that with her respiratory rate. I'm going to go ahead and put her on high flow O2. I would do that via non-rebreather. Okay, moving on to circulation. Does my patient have a radial pulse?
She has a weak radial pulse at a rate of 130 beats per minute.
Okay, weak radial at 130 beats per minute. I would go ahead and assess for any major bleeding. As I look down at her body, do I notice any major bleeding?
Just what you see on the lower leg.
Okay, so I would go ahead and actually expose that right away to see exactly what's going on. Do I see any active bleeding right now?
It looks like bleeding is minimal.
Okay, bleeding is minimal, so I'm going to note that and I'm going to come back to it. So based on, now I'm going to assess her skin. What does your skin look like?
Her skin is pale, cool, and diaphoretic.
Okay, so based on her pulse rate and her skin presentation, I'm also going to treat for shock right now. I'm going to make this a priority patient, and we're going to transport immediately. If she was conscious and able to talk to me at this point, I would obtain a sample history. Because she's not, we'll bypass that. Secondary assessment, I'm going to do a head to toe, palpate the head, the face. I will check her pupils. What do her pupils look like?
Equal and reactive to light.
Awesome. Inspect the ears. Do I notice any fluid coming from the ears?
There's no fluid coming from the ears.
Okay. I already inspected her airway. Neck. I'm going to palpate her neck, check for JVD or tracheal deviation. Do I notice anything in her neck?
No, you notice nothing.
All right. Chest. I'm going to inspect for equal rise and fall. I'm going to palpate her chest. Okay. Patient again responds painfully to palpation. Does their chest feel stable though?
It does feel stable.
Okay. Moving on to the abdomen. I'm going to palpate the abdomen.
It is soft.
Soft and not
in all
tender?
quadrants.
Okay, awesome. Pelvis. I'm going to palpate the pelvis.
Pelvis is stable.
Okay. Moving on to the legs. Palpate the upper legs. All right. Patient responds painfully to palpation there. I'm going to go ahead and straighten this out. As I inspect this leg, what do I see here?
You see a deformity to the lower leg.
All right. Deformity to the lower leg. And how about this over here?
It's normal.
Normal. Okay. So I'm going to assess pedal pulses. Do I have pedal pulses?
They are present.
Okay. Normally I would do a complete CMS check, but since my patient isn't really responding to me, I know I've got pedal pulses. Same with wrists. Do I have full circulation up here?
Both pulses are present.
Okay. So I've got a head to toe done. Now, we'd be transporting, so I'm going to go ahead and manage my secondary injuries. The things I'm concerned about are the decreased breath sounds. I'm managing that with oxygen, and I'm just going to keep monitoring that. Also, this leg, when I put my patient on a backboard, that would be managing that. That would be splinting that leg. Also, when I put the patient on the backboard, I would go ahead and palpate the whole back and check that and make sure that there weren't any other injuries there. So now let's do a baseline set of vitals.
Your blood pressure is 92/68.
Okay,
Your pulse is 108,
okay,
and your respiratory rate is now 22.
all right. So again, we've got these secondary injuries managed. We're going to go ahead and continue reassessing, continue reassessing the breath sounds, continue reassessing the leg, checking for distal pulses, and then I would continue reassessing vital signs every 5 minutes because she's a critical patient.
Is there anything else you'd like to do?
No, that's it.
Thank you.